Hi, everyone. Hi, good afternoon. Doctor, and delegates. It's a beautiful Friday. And thank you so much for joining us here online. Well, first of all, thank you, Dr. Pan. Sincerely, thank you for giving us a chance to hold this online seminar. Consider this the first Malaysia Parabiosis Anti-Aging Tech podcast. Having here with us today, we have doctors, practitioners, and delegates from across Malaysia, of course, Thailand, Indonesia, Vietnam, and some of them might be joining us from London and San Francisco. Thank you again for joining us here, and I hope you all are doing well. So it's probably very little of our audience today know about Dr. Pan. Dr. Pan actually started his research life in a very early age, as his late father was a very prominent scientist in Taiwan and also a professor from University of Kyoto, Japan. Therefore, Dr. Pan has been introduced into a lab at very young age. Dr. Pan received his education in NTU, National Taiwan University, and later advanced abroad into University of Chicago. There, he firstly received his PhD in chemistry and then also the medical degree, both in University of Chicago. During his practice in the University of Pennsylvania, Dr. Pan was given the seed grant to establish the anti-aging medical program for the very first time back in the 1990s. Dr. Pan is the first Asian plastic surgeon which is certified by the American Board of Plastic Surgery and currently hold the position of a Chief Secretary in Taiwan Association of Anti-Aging Medicine. His expertise lies in biochemistry, biophysics, mathematics, and biotechnologies. Dr. Pan is also the Chief Technology Officer in Lotus Biotechnology Private Limited, exploring the human anti-aging modalities. So I must say I'm very lucky and honored today to have the chance to host this wonderful webinar, where Dr. Pan is going to share his research and clinical works in heterochronic parabiosis, a very wonderful topic related to aging reversal and the clinical approaches to treat age-related chronic disease. So let's do no further. I'll welcome our excellent speaker today. Welcome, Dr. Pan.
Hello, everybody. Okay. I'm assuming what I'm talking about, I'm assuming everybody is online now and ready, getting ready to participate in this talk, okay? And first of all, I want to thank Mr. Lu to give me the chance to have the opportunity to share our experience in anti-aging for the past 30 years with you online, okay? And I understand most of the physicians online today are from Malaysia. And as I always say, you know, I have a spot in my heart which belongs to Malaysia because about 10, 15 years ago, I already have the chance to set up a ADSC, adipose stem cell company in Penang. So every time when I get a chance to speak with people from Malaysia, I feel very happy about it. Okay, so I'm going to get into my talk right now. So the topics of my talk is the science of aging reversal. Okay, so this is not going to be a very heavy medical talk. And I'm not going to give you a lot of jargons about medical terminology and this and that. But instead, I'm hoping to give you another viewpoint about looking at the anti-aging problem, and also as a physician, how can we utilize the science of aging reversal and to incorporate them into our practice, okay? As Mr. Lu addressed, my background is kind of weird because my father was a medical doctor, but he is also a medical researcher. So I began my laboratory work when I was 7 years old. And I published my first paper when I was 14 years old. But contrary to what most people will expect, I didn't go to medical school in college. because I don't want to run into my dad in the campus of National Taiwan U, and and he would tell me do this and do that. So instead, I decided to go into chemistry. And after chemistry, I went to University of Chicago. And the reason I go to University of Chicago is because my father go to University of Kyoto in Japan. So I got to go to somewhere other than Japan. So that's how it started. So I went to University of Chicago, and I got my PhD in physical chemistry. And after that, when I getting old, you feel like, maybe your father is right. So I decided to get into medicine. So at the end, and I actually followed the path he expected me to do. So, and as Mr. Lu addressed, I am a plastic surgeon, and by definition, it's a craniofacial surgeon. So I started my early clinical works in CHOPS, Children's Hospital of Philadelphia. That's how we started all the stem cell and other research works on this. And I also, this is my disclosure, and like Mr. Lu said, I established several companies in Asia, and which including the one in Malaysia, and I also have a company in Cambodia, and which we will also talk about it in the later of the talk. So my talk, I'm expect to give it to finish in about 75 minutes, okay? And I organize my talk into 6 parts. And the first part is I give you my point of view about aging. Then I will follow with a discussion about the history of heterochronic parabiosis, which is the fundamental experimental model based on for our talk. And after that, I will tell you what has been developed regarding the clinical application of this experimental technology, which is the pairing of old and young animals together. And after that, I will begin to tell you our experience in developing the current procedure of applying heterochronic parabiosis into clinic practice. And I'll show you some of the clinical results and finish the talk with a discussion about the potential developments and the opportunities of all the doctors which is interested in regenerative medicine and or anti-aging medicine and or cell therapy. So I will start my talk with this interesting diagram. And this is the x-axis is the age of the death of the US population by this is of woman, okay? So the dashed line is the 1993 curve, or we call it the death of age curve. And the solid line is at 8 year of 2014, okay? So there are about 80 years difference in between. So you can see the increase on the average of the lifespan, contrary to what most people think, is really the decrease of the death resulted during the childbirth. Okay, so it's a very big decrease in the mortality because of the advance in gynecology and the obstetric care. And the actual increase in the lifespan is actually not as big as what most media says. That they always say that you get 5 years more lifespan every whatever years, but it's really not the case. Okay, but the most interesting, and I think is the most important one, is the maximum lifespan actually has not improved at all. So in other words, that during the 80 years ago, the longest woman will live in the States is around age of 110. And 80 years later, 2014, and the maximum lifespan of the woman in US remains the same. Okay. So as a result, let us look at another graph. This is from the World Health Organization. And the picture shows the shows the chronic disease of every aging bracket. As you can see here, that for most people who is between over 60 years old, and they are going to have 2 or 3 medical disorders. For people getting to close to 80 years old, and you can see that 90% of them is going to have one or more different diseases. So the two graphs tell us one thing, that although we can live to age of 90, maybe 100, but after the year of 65, we are actually living with a disease. Most of us is going to living with a disease, including myself. And I have gout and I have hyperpressure since that. And this is the case. And you can also look at the disease curve here. You can see that after age of 65, most of disease, which includes cancer, diabetes, Alzheimer's disease, and cardiovascular disease, including the COVID-19, the mortality rate increases dramatically after age of 65. So all these tell us that in the past, the medical technology is trying to extend the life. But since our maximum lifespan is not going to increase dramatically, it is not expected to increase dramatically over the past 10, 20 years. So there is a paradigm shift of medicine, that instead of continue to increase the lifespan, we are hoping to increase the health span. So in other words, that we want people to live healthy until the last minute, and they can drop dead. And I think that's probably the hope and the goal of the current medicine. We also know there are many diseases which is associated with aging. And as many of you know, the baby boomers just become age of 65 around year 2000. So in the early 21st century, a bunch of scientists begin to get aware of the importance of aging and the aging-related disease. They came up with an important paper address the hallmarks of aging, and there are a bunch of technical terms, which includes stem cell exhaustion, intracellular communication, the alteration of the intercellular communication, genomic instability, telomere shortening, and etc. And more recently, there is a lot of research addressing the cellular senescence. So in other words, we are coming up with a bunch of mechanisms, such including what I just talked about, which all are possible causes of the aging and the aging-related disease. If we do a more detailed analysis of those mechanisms, you can find that the all hallmarks of aging, you can classify them like the following slide. In other words, that the aging is actually there. If you want to break them into two categories, there will be genetic cause and epigenetic cause. Then after that, then you're going to have breathing. When you breathe, you're going to create a bunch of reactive oxygen species, and then you have those hallmark of aging, which I just addressed. And after all those hallmarks of aging, they will eventually result in chronic inflammation and tissue fibrosis. And when these two things begin to occur, people is going to get into a disease state. But it seems simple, but because of the dirty nature of the biology, this is a statement by Judith Campisi, which is one of the people who wrote the original paper on hallmarks of aging. And she always says that the aging problem are so complicated, it's almost impossible to address it in a scientific way. And what's even worse is that there are so many research being done about aging, and aging-related disease. However, the success rate of bringing a successful laboratory experiment to clinical practice is only 8%. Okay, in other words, you can see a bunch of papers published in Nature and Science, and they are doing very good work. But at the end of the day, only less than 1/10 of them can become clinically useful. So as a doctor who has been involved in anti-aging medicine very early in my career, so I want to ask the first question, that is there anything more basic on aging, rather than talk about all those complicated issues, telomere, DNA, RNA, regulations, RNA, and this and that. So like what I just said, when I was that was back in 1994, when I was in University of Pennsylvania. I was the young lecturer, and I was given the mission of give a lecture to be responsible for the anti-aging medicine class. So I do a bunch of studies, and at that time, the concept of aging is very simple. Basically, we only look at the aging with two types of causes. One is genetic, and the other type is epigenetic. The genetic cause is basically like a program of our cells. So what it is saying is that when you get older, and some people get older at the age of 50, and that was programmed when you are born, and then some people can live to 80, and since it's just like a genetic disease. And the epigenetic concept is the opposite. That means that it's more like environmentally influences. So that's a two big school of the about aging. So the question we need to ask is that is aging due to programmed cellular aging or not? Because if aging is due to the genetic reasons or programmed cellular aging, then it's very little we can do, because we are born with it. And at this stage, to the best of my knowledge, trying to change the gene profile of everybody, I think is still pretty difficult. So if aging is due to programmed cellular aging, then there's very little we can do. So let me show you a couple experiments about this. So this is a German group. What they do is that they take the bone marrow stem cells from different age group. So from the young age, from the middle age, and from the old age. And they put these cells, the bone marrow MSC, in the lab and trying to grow them. And you can see that the top one, which is actually from a man who is 80 years old. Okay, so in other words, that although the host of this BMSC is 80 years old, but the his cell actually has the best performance. So, and this is another study which is about the studying the cardiac stem cells of different age. And the results is very similar. And I think this is good news because of this. So that means that there are some factors we can do something about it. So the answer of whether aging is related to the cellular programmed aging is no. Or we can say aging is at least partly due to epigenetic factors. So, and as Mr. Lu first introduced me, hey, you probably know that I was trained as a physical chemist. So what physical chemist does is that we study the physical phenomena related to different chemical reactions. So because of those epigenetic factors, then are governed by the law of thermodynamics. And I will try to show you the relationship between thermodynamics and the aging. So there is the first law of thermodynamics. You don't need to know anything about it. The only thing you need to know about it is first law is about the conservation of energy. So in the past, we used to think the metabolic rate of someone slowly to decreases after age of 20. But a very important study published last year in Nature is showing that actually that was not the case. So basically, the metabolic rate was maximized in age of 18 or 20. And after that, it began to decrease and enter a plateau. And you actually only decreases after age of 65. So what it says that before the age of 65, basically the metabolic rate of a human over any adult stays about the same. And after age of 65, the metabolic rate begin to decreases, and the number of the chronic disease or the incidence of chronic disease begin to increase. And the coincidence of this is so dramatic that you cannot avoid addressing the relationship between the decrease in metabolic rate and the chronic disease incidence. So let me show you a very simple arithmetic calculation. So all what that says is that when somebody is at age of below 60, the energy you take in and the energy you expended is about the same. So the net energy is zero. And when people become more than 60 years old, if the food intake is the same, because the metabolic rate begins to decrease, so you're going to have a net excess of energy. And it is those excess energy has to do something because of the low thermodynamics. So those excess energy will cause all those hallmarks of aging. Okay? This is the thermodynamic view of aging. So as a result, if we can stop taking in so much calorie after age of 60, or begin to do exercise, that is to increase spending more energies, then you eliminate all the excess energies. So as a result, the entrance to the hallmarks of aging will be prohibited. So this is the reason why dieting and exercise are always the king and queen of anti-aging. And this is probably the most well-studied anti-aging methods. And if you look at the causal relationship, you can also see that the exercise and diet actually is very effective in blocking all those hallmarks of aging. However, if you want to live a healthy life, and by using diet and the exercise, then you probably can always have so little food in your plate, because you have to reduce about 35% of the calorie intake in order for fasting to be effective. Or you have to keep on running probably 3-4 hours a day, and in order to live longer. But everybody knows diet and exercise are so hard. Even you can do it for a short time, but it is very difficult to be persistent on this. And you can also see so many people keep on doing diet and exercise for their whole life. And as a result, we must say that although diet and exercise as an anti-aging means are scientifically sound, but are clinically very difficult, although they are free. Okay, so we ask ourselves: is there any other way other than diet and exercise that we can slow down the aging or reverse the aging effectively? Fortunately, there's a technology which was done in about 150 years ago. And the original experiment about parabiosis, that means stitching two rats together, was done by a guy called Dr. Paul Bert. It's a French surgeon. And after that, Cabral, Dr. Alexis Cabral, in my alma mater, University of Chicago, he did a bunch of experiment on transbiosis. Okay, and by connecting an old and young animal together, that was first done by Dr. McKay in Cornell, and that was in 1957. Okay, so what is important about heterochronic parabiosis is that, to the best of my knowledge, I think it is still the only rapid and visible aging reversal experiment to date. Okay, there are so many cellular cell culture experiments or small animal experiments, and they talk about the anti-aging effect, but I think either the progress is so slow or the changes are so little. You need to do a lot of standing, doing a bunch of studies on the pathway. I don't know of any other ways other than heterochronic parabiosis, which can give you visible changes in the age of the animal within 5 days, and that's very fast. Okay. So what happened in heterochronic parabiosis is that when you stitch the abdominal skin of two mice together, and they begin to share their blood. So if we can do this in human, and then we don't have to do this talk. So what we have to do is just connect the skin of our belly with a young boy, and that is all. Okay, but most of people think that connecting two people is clinically impossible, but it is really not the case. The first exception is the conjoined twins. Okay, but this is because they are at the same age, so it's really not. They are just parabiosis, and they are not heterochronic parabiosis. And another good example is pregnancy. And pregnancy, the mother is always older than the fetus. The fetus will be probably 1 year old, and the mother can be between, say, like 18 to 38 years old. Okay, so this is a heterochronic parabiosis by definition. But because the size of the older animal or the mother is much bigger than the size of the fetus, so this is we can call that pregnancy as asymmetrical heterochronic parabiosis. So, and people begin to study about this the effect of the pregnancy on the mother, and the result is very interesting, because on this curve you can see that if mother has the last pregnancy at the age of 45, and she will be the probability that she will live to 80 is going to be 50% higher than the other group of mother who has the last pregnancy at age 35. And the reason of this is because the fetus is age of 1. So when mother get pregnant at age of 45, the difference in age is much bigger as compared to when mother get pregnant at age of 35. So the advantage or beneficial effects of the heterochronic parabiosis will be more significant for the first group, which has the last pregnancy of age 45. So the first and the most easy way to get effective on heterochronic parabiosis is to get pregnant at an old age, okay? So how can we do it? But most of us, especially men, cannot do this, cannot get pregnant. So how can we do it when two animals is separate? So the intuitive thought about this is that people begin to guess that the reason people can get older is because when people are young, you have a lot of young factors in the body, and these young factors slowly decreases. So when you get older, and the young factors are very little, and this is most people intuitively think. And if you believe in this, then in order to reverse the aging, all what you have to do is to increase the young factors in the old body. So if you can infuse young stuff into old people's blood or in the buttocks through IM injections or things like that, then you will be able to reverse the aging to help the client back to a more useful state because you increase the young factors in their body. And this is what doctors 100 years ago thought, okay? The pioneer in this is the Dr. Alexis Carrel, who I mentioned during the earlier in the talk. And he was the Nobel Prize winner in the 1992. And he is a pioneer, not only in heterochronic parabiosis, but he's also a pioneer in cardiovascular exocorporeal circulations and things like that. So what Dr. Carrel did is rather than stitching the organ to a young animal, what he did is he put like a chicken heart in a dish and just replace it with different extracts from a chicken embryo. And by doing this, he was able to keep chicken heart viable and functional for almost 35 years. This is the first experiment about extending the life or reversing the life of or extending the life or reversing the aging of an organ in the lab. And after that, this is a very famous doctor. I think most people know about him. He is Dr. Paul Nihans, and he was inspired by the Carrel's experiment. So in 1931, he established a clinic in Switzerland. It's later become the brand called La Prairie. And the Pope, the famous actress Elizabeth Taylor, and Charlie Chaplin, and Winston Churchill are all their patients. And because his patients are so powerful and famous, and Dr. Nihans was also the first established anti-aging doctor in the history. So another group of people in Japan, 40 years later, and they adopted the same concept of Dr. Nihans. So rather than taking the extras from the lamb, the fetal lamb, Paul Nihans, I forgot to say that Paul Nihans got the tissue extras, the embryo tissue extra from the albino lamb, and in the Japanese company begin to collect the useful factors from the placenta of human, and they established two companies, and one is called Lanek, and the other one is called Mailson. And right now, I think only Lanek is still in the market, and they have many doctors. There are many clinics in Japan who injects placenta extracts for anti-aging patients from all over Asia. In the West, the same concept begins later, although the history or the story about vampires was as early as the 100 or 200 years ago. So in the West, only in 2014, a Stanford graduate called Jesse Kamazin, and he was a medical student, and he was inspired by Steve Jobs. So he heard about the heterochronic parabiosis experiments. So he thought of a business model, and that is to give money to the young college student and ask them to donate blood to the company, and he then transfused the young blood to the blood type matched rich people in Silicon Valley, and the company called Ambrosia. And the company was very, very famous and doing very well in a very short time. And the business was so good that the FDA immediately get aware of this their practice and begin to issue some warning on this. And the reason FDA warned about this is not because the procedure was illegal or harmful. The reason the FDA warning about this is issued a warning letter is only saying that the ambrosia therapy was not proven to be effective. It didn't say it's not effective. It's just not. Or what FDA is saying is that the ambrosia treatment is lack of clinical trials. So they have only very limited clinical data. At that time, I think this is probably one of the most important papers on heterochronic parabiosis. That was published in 2016 and by a scientist in University of California, Berkeley, Berkeley University. So this couple is the husband and wife couple of scientists. All what they do is they want to address the issue of applying heterochronic parabiosis to a clinical stage. So they implement experiments rather than connecting the two animals together. They try to draw the blood from the old animal and inject it into the young animal and vice versa. And this is what they do. So this is a young animal, this is an old animal. And they will take out some blood from the young animal and inject it, take out something from the old animal and inject it into the young animal, and take out some blood from the young animal and inject it into the old animal. So if you do the simple calculation, you will be seeing a graph like this. So you have a young animal like this. Now you take out a little bit of blood from the young animal. So the young animal, because they have so much young factors, so they are in their body, the young factor only reduced by a little bit. And for the old animal, because they have very little young factors, and if you inject the young factors into the old animal, the percentage of increase in young factors in the old animal will be much, much bigger. So original anticipation of the experimental result was that the old animal will grow much younger and the young animal will only get a little older. However, the experimental result was just opposite. In other words, that the young animal was become much older with only a little bit of the old blood getting infused into their body. So contradicted to most people's intuitions, they think, that is to say that most people think that the young people has young stuff, which is good, and old people has little young stuff, so it become old. Rather than things like that, is actually old people has a lot of old stuff, and young people has very little old stuff. And that's the reason, in other words, that the aging substance is the dominant factors rather than the useful substance. Okay, that's is the dominant factors. So if we use driving a car as an analogy, or what we are saying that this is like the brake and the gas pedal. So the old aging substance is like a brake, and the young substance is like the gas. So in other words, if you have so much brake on, and no matter how much gas you add it in, the car is not going to move. And that's basically the concept. So in short, then the combo experiment told us a very, very important information. That is to say, the aging substance in the blood, at least, is toxic to the young animal. And their experiment was repeated many times, even up to this year, and pretty much established the concept that old blood is more powerful in aging to inhibit the young substance. So the concept was picked up was similar to what Dr. Dobry Kiprop, and he's the first guy who was board certified in plasmapheresis in the States. So he was aware of the heterochronic parabiosis experiment. So back in 2013, he already began to think of applying a plasma exchange machine and using the machine to remove the bad stuff and inject back the some of the stimulation factors, and hoping to make his patient become younger. In the early stage of his practice, he uses fresh frozen plasma as a replacement fluid. But there were so much allergic reactions, and he slowly changed it to using 5% albumin and the IVIG, intravenous immunoglobulin, as the supplement. And by doing this, he was able to reduce the allergic rate to less than 3%. So this is pretty much what they're still doing in the San Francisco. Okay, a company called Grifols, who is the maker, one of the largest supplier of the albumin, pick up this information and begin to apply their technology in the treatment of Alzheimer's disease. And they were able to perform a early phase 3, we call it 3A clinical trial on early and middle stage Alzheimer's patients. And the results were published in 2 years ago, 1.5 years ago. No, it's 2 years ago now. So what they see is that by doing TPE, therapeutic plasma exchange, you can decrease the rate of deterioration of Alzheimer's patient, which is a control group, by 70%. So the treated, this is the MMSE score. That is a score to measure the severity of the Alzheimer's patients. So in other words, the treatment group will slowly get worse, okay? But the patient without treatment is going to get worse much faster. So this result is very striking to the anti-aging medical field. In fact, because of these dramatic results, the Grifols was able to team up with a neurological clinic called ACE, Alzheimer's Center. So in Barcelona of Spain, they begin to set up plasma exchange centers for the treatment or for the control of early and mid-stage Alzheimer's disease. And in the Berkeley group, they also begin to using the same protocol to in a serial to decrease the CRP, C-reactive protein, of old people using serial plasma exchange. Okay, so these are the same thing for other different terminology for the same thing. So in the literature, if you see plasmapheresis, plasma exchange, or DLPP, double filtration plasma pheresis, or plasma dilution, these are all addressing the similar process for the aging problem. Some people may be wondering, maybe this is just due to the albumin, and the author of the original paper on the old blood is toxic, and she was able to do the experiment, and what she observed is that if you excluded the albumin, there were no dramatic change in the effect. In other words, that she doesn't think that the effect of the plasmapheresis with replacement fluid is anything to do with the albumin. So with that given as the background of the heterochronic parabiosis, I begin to tell you our story about applying heterochronic parabiosis to develop an effective anti-aging and program for clinics. So like what I said, I was begin to involve in anti-aging and regenerative medicine back in the early 1990s. And after that, I came back to Asia and began my practice in Taipei, and I was doing a lot of facial surgeries. In 2016, because of in 2012, I was participate in a competition for a product in the Beijing of China. And at that time, I was bring to the attention of the heterochronic parabiotic experiment result. So, but I didn't do much about it until 2016. Okay, as that was the time when the ambrosia Stanford entrepreneur Jesse Cummins began to do the blood transfusion of the college student into the old people. So what happened in 2016 was a trip, a surprise trip to the Cambodia, to the capital of Cambodia, Phnom Penh. At that time, an old friend of mine lived in Cambodia, and he asked me, because he has a friend who is a general there and has some neck problem, and he asked me to go to Cambodia and to treat him. Okay, so I flew over there and met the general, and this is the first time I was there. And what surprises me is they give me the following information, and that is because the Rook Khmer, the Cambodian is actually one of the youngest population, has one of the youngest population in the world, because a lot of old people was killed during the Rook Khmer age. And because of that, and there are so many young people, and you can see so many kids running around on the street. And what really attract our attention is that I saw about a family of 6 and riding a bicycle, okay, a motorcycle like that, things like that. So, and after the motorcycle, I see a kid, and he was riding a motorcycle. And I asked my friend, I said, wow, is there any regulation about riding any age limit about riding a motorcycle in Cambodia? And the answer is, in Cambodia, if you can get on a motorcycle, then you can do it. Basically, there's no restriction, no age restrictions. And at that time, an idea come to me, and I begin to ask them, say, so is there a restriction about drawing blood from the kids? And the answer is no. Basically, the answer is the same. What he says that if you can get blood, then there's no age restrictions. So our idea based on that was following the Jesse Cummins concept. Was that because originally we are thinking about using the teenagers in Cambodia, and we want to buy blood from them and using the blood to make young fresh frozen plasma for the injection. But as I mentioned, that was 2016, and we begin to prepare to set up a blood transfusion clinic in Phnom Penh. But during that time, the Conboy's Lama paper published, and like what I said, the Conboy proves that the old blood is toxic, and because of their paper, we decided to combine the therapeutic plasmapheresis with the fresh frozen plasma of the teenager. And that was our original business plan. That was to set up a clinic which will let the client go through the plasma exchange. And after that, we replace the plasma with FFP of teenagers. And what happened is that we try to do this and try to market this product. However, the response was actually very poor. And the reason is most of the people got very interested in the idea. But when they ask us where is the plasma coming from, and they begin to understand it's actually coming from Cambodia, and they got very hesitant about it because Cambodia has lots of AIDS, and it has a lot of other STD, sexually transmitted disease. So very few, there are very, very few people finally accept the concept. In the same time, most of the our patients in Taiwan and Malaysia, and the blood vessel is so small, and we also have a problem using a TPE machine. and to do the plasmapheresis on them, because this usually require a 17 gauge needle. So with this poor market response, we are forced to implement our treatment. So what we are trying to do is using the bloodletting, which is just like donating of blood, which is legal, and people are not getting frightened by the big needle about bloodletting. At the same time, we begin to use artificial plasma replacement fluid and combine with some hormone and the cytokines, and to make a bag of fluid and use it in combination with the bloodletting. So what we do is that we will take out 150 cc of whole blood and replace it with some of the artificial plasma. So at that time, another group of doctors in Stanford, they published a very important paper about how to make the plasma younger. So what they say is that there are 4 types of factors in the plasma, and most of them are common factors. That means that the concentration of those factors in the young age and old age is the same. And there are adolescent factors. That means these factors has the maximum concentration at the age of, say, like 15, 16. And there are beneficial factors, and that are the factors which slowly decreases with age. And finally, there are harmful factors that are the factors gradually accumulate through our life and become saturated at the age of, say, like 40 or 50s. And they classify the factors into 4 different categories in the plasma. So with those concepts, so what we are trying to do is that using all those informations and my background in chemistry, so we try to take out a bunch of, say, like 150 cc of blood out of a patient each time, and replace it with 150 cc of different plasmas, and we call it intermittent plasma conditioning. So in the early stage of our program, and we run into some problems, and one is the allergy problems. So in the early stage, our formula will induce about 30%. 1/3 of the patients will have some allergic reactions, and the other one is cytokine storms. We will say about 5 to 10% of the patients, because there are not clear guidelines for the dosage for the cytokines, and sometimes they might run into cytokine storms. That's going to a low blood pressure, and this is quite frightening experiments. And at that time, and thanks to the advance of the proteome analysis, so this is the Stanford group. They're using a new technology to analyze about 7,000 proteins in 3,000 subjects. So they are able to identify a lot of proteins which are in relationship with the aging. And because their work is sponsored by the U.S. government, and their result is available online, we begin to tap into their database, and eventually we identify about 10 different medication or different substances that's related to the age. And we begin to fine-tune the formula, the composition of these substances. And finally, we are able to come up with a compounded IV solution, which has a low allergic rate and the high response rate. So this was from the Q3 third quarter of 2018. And since then, because the procedure has very high level percentage of reception, so we were able to do over 1,000 sections very quickly within 1.5 years. But at that time, people begin to come back to us. But when people come back to us for second or third time, and they begin to ask us that, do you have any laboratory data on our improvement and things like that? So we are forced to develop a diagnostic method, which to explain the progress of the plasma conditioning. So what we do now is this. We will take our patient's plasma, 100%, okay? We take patient's blood and to the lab and separate the plasma. And we will give it to a certain amount of the stem cells. We'll use them to culture them. Then observe the residual number of the stem cells within a week. So what we see is that most of the patient, the plasma the survival rate of the stem cells in the plasma is less than 1%. Okay, and this is very important information, and we didn't expect. We are not expecting this type of result because people like us, we were doing cell transplant, stem cell infusions. We thought we know the survival rate probably is not that high, or the retention rate is not that high, but we didn't expect the survival rate to be so low, which is less than 1%. And what we are trying to do, and I think is very unique, is that we go one step further. That is, we begin to use some medicine as a control, and we begin to tune the different proportion. So in other words, that we come up with a formula which can improve the survival rate of the stem cells in the plasma, okay, by hundreds of times. Okay, this is the type of diagnostic tool we have now. So this is the same patient, and after 2 or 3 plasma conditioning sessions of 150 cc, and you can see that in about 1 month, you can see the very significant change in the survival rate of the stem cells in different type of composition of the plasma. So with this tool, we begin to get into larger clinical trials. So you can see that the same patient, this is the survival rate curve, and you will gradually improve with time, okay? And at the end of the treatment, you can see that the survival rate of the original plasma is already improved by 100 times. So how long will this improvement chain last? So you can, in this graph, you can see that after the second 2 sessions, the patient, the result of the patient can last for about almost 3 months, okay? And this is more data on this. And if you are interested in knowing more of the result, more of our diagnostic method, then we can spend another talk and for these special topics. So the result is that if this is the original survival rate of the stem cell in the patient, and with 5 treatment, you can see that the survival rate of the stem cell in the patient's plasma was increased by 120 times. And this is a very shocking experimental result or clinical result. And the patient will also come back to us, begin to tell us that his grandchildren begin to tell him that he's beginning to grow dark hair, and they think this is a very interesting phenomenon. And the patient is 95 years old. Okay, it's a 95 years old Asian man. Okay, so we continue in the hoping to optimize our treatment and trying to implement our treatment protocol and make it more safer and more effective. So what we do now, we begin to considering the patient's body weight and the volume of the fluid in the various compartment in the body. So in order to fine-tuning the compositions of the plasma, then we need to do some calculations. And another reason we need to do that is because since we have to take out 100 and 150 cc of the blood, so some patients, especially for the very old age group, they might run into anemia. So as a result, we need to study the half-life of this treatment. So by continue following some of the patients, and we are able to come up with a graph like this. So, and you can see the patients after 4 sessions, the survival rate of the stem cell become improved by 120 times. And about 5 months later, then we can do another experiment, similar experiment on the same patient. And you can see the improvement of the stem cell survival rate will drop by only 50%. Okay, so what we are seeing, then this is the most recent data, and the same patient, we are following him for even longer. So basically, we are able to, using our formula, to tune the survival rate of the stem cells, to tune in his plasma. Okay. So what we are saying is like this. So what you need to see is this is the survival rate of the stem cell in the plasma originally, and this is the survival rate of the stem cell after the treatment. Okay, so this is a 40-time difference of the survival rate. So, and this is the goal of the treatment, because if we do everything right, by the end of the day, we should be able to increase the survival rate of the stem cell in the plasma by another 400 times. So we give a summary, a short summary right now. So, but basically what we find is that the old plasma, which is toxic, and in our experiment is very clearly shows that the stem cell, okay, cannot survive, cannot be supported using an old plasma. And this plasma can be improved in 3 to 6 plasma conditioning sessions. And the result of the conditioning can be kept for about several months. So this is basically what we see. And with these informations, we are able to fine-tune our intermittent plasma conditioning program, and we using a biochemical or pharmacological recipe or formulations. So basically, what we just show you is something like this. So basically, you have a patient like this, and you took 150 cc of blood and give it. We separate the plasma, his plasma, and give it to 100 stem cells. So in the beginning, after 7 days, there are only 3 stem cells left. And if you do some plasma session, couple plasma session, each time you will infuse 150 cc of the replacement fluid. Okay, so then 2 months later, you took out the same patient's plasma and to the lab and give it to the same stem cell. And 7 days later, you can see that the stem cells will begin to grow to 360. So from 3 to 360, that is 120-time improvement. And if you don't do nothing, then 6 months later, you do the same experiment on the patient. You took out his plasma and give it to 100 stem cells again. Then you will have 180 stem cells survive after 7 days. So this is basically what we can show, what we are showing now. So as many of you are physicians, so you must be aware that most of the medication, the half-life is very, very short. So basically that's the reason we need to take medications say like once a day or once a week. To the best of my knowledge, is GLP-1 injection, that's about it. But there are very, very little medicines or that can last for months. So what we think is that our formulation is acting pretty much like a vaccine for aging. Okay, so we also address the same question: is this due to albumin? Just like Dr. Comboy in Berkeley. So what we do is that we bring the albumin to the lab and give it to the stem cells, and there are 0 survival rate. And you need to basically what we are saying is that there's no reason none of the stem cells will survive in the albumin. Okay, so this experiment proves that the result is not due to the albumin, and the albumin is actually toxic to the stem cell alone. So, in summary, what we have shown you is that plasma is essential to the survival of stem cells, and the good plasma is essential to longevity. And the reason we come up with this statement is very interesting. Originally, we thought the older people, the plasma is worse because the older the plasma, there should be less useful substance and more old aging substance. But our data now begin to show that for those people who are over age of 80 or 90, their plasma, although the activity is not good in the beginning, but their plasma actually responds much better as compared to our treatment, as compared to the younger counterparts. In other words, that we find that for those people who live to old age, that means that, let's say, like more than 85 years old, their plasma can be adjusted, or we can say their plasma, the condition of their plasma is more malleable as compared to the other part, which is patients who is young age but who had a stroke or something like that. So our treatment now is we separate to 2 phases. One is the intense phase, the other one is the maintenance phase. So intense phase is that we did it once every other week for 3 times. And for the maintenance phase, we can do it every 3 to 6 months. Okay, and it depends on the individual analysis. We sometimes have to give them some supplementation for the cytokines. And here are some case studies. And one is a patient, a friend of mine, and he has a big company in China. And he came to us actually 3 years ago, and he did one plasma diagnostic studies. And you can see that his plasma is actually very poor, response very poor. And what's interesting is that his serological exam, basically all the routine blood tests are all normal. So when I see this very poor result, I call him up, and he answered me, and he said, "Whoa, how do you know I just had a stroke?" Okay, so what I'm trying to say is that for people like him, who don't drink, no smoke, and do exercise every day, and he did a physical examination every year, and everything is normal, but he had a stroke, and our plasma diagnostic experiment clearly shows that because his plasma cannot support the stem cell to survive. This is a very good example. And he began our plasma conditioning therapy for about 10 to 20 sessions. And he is now able to back to play tennis. Okay. And then this is a video from last year. And now he just came to us a couple of weeks ago. He was saying that he's doing even better now, okay, on the tennis court. And then the other patient is a patient who has a diabetic chronic kidney disease. And we did the same thing, the same type of plasma diagnostic studies. Then she began to get some treatment. So after 7 sessions, and her eGFR was increased by about 20%. Okay, so we see this type of result on chronic kidney disease quite often in our clinic. Okay, and the other type of people who will come to us are usually those their son or daughter came to us because their parents become very, very old. We call it the frailty or sarcopenia type of patients. And this type of patient, originally we thought their performance, the survival rate is very low. But actually, these are the response to our plasma conditioning therapy very well, because with a few sessions, usually they can improve their stem cell survival rate very quickly as compared to the younger parts. And you can see that this is a photo for her hair, and this is from the dye, and this is her hair, and you can see the new hair growing out of her scalp dark in color. Okay. And there are so many other cases, including like the presbyopia improvement, the menstruation comes again, and post-surgical recovery, Alzheimer patients, and some of them who is like this patient who is 90 years old, has a pancreatic cancer and also TKA, and he was put into a hospice, and his son come to us, and he said he wanted to try our plasma therapy, so we give him some plasma, and he bring it to the hospice and infused to his father, and his father was able to recover quickly and eventually got out of the hospital and lived to another almost two more years. And this gentleman, his son, is our representative in Phnom Penh, become our representative in Phnom Penh, Cambodia. So what I want to tell you is that this heterochronic parabiotic type of plasma exchange therapy is originally an experimental method for studying the aging. Okay, but now we keep on implementing these type of things, and then there are probably 4 ways you can apply this heterochronic parabiotic principle in the anti-aging medicine. So the first way you can do that is the natural way. Means that you can remove the aging substance by menstruations, and you can get the useful substance by getting pregnant. The other one is we call it biological way. You can do the bloodletting and infuse it, young blood into the body. This is called the ambrosial way. Now, the third way is using a plasmapheresis machine to wash out the toxic substance and replace it with artificial plasma fluid. And what we are doing is that we are using a combination of biochemicals, and which will remove the toxic substance and increase the useful substance in the one-part therapy. And there are different advantages, and we are not going to talk about the natural way. Then you need to get pregnant, but eventually it's pretty expensive. And for the biological treatment, then the supply of the young blood is very limited, and there is always risk for contacting infectious disease. And the physical way means that using the machine combined with artificial plasma replacement. Then this type of treatment, you need to have a large vessel, and the patient's willingness of accepting this type of treatment is more limited. In our method, the advantage is very minor procedure. So most of the patient can tolerate this type of concept. And the cons are, because this requires multiple sessions, you cannot do the therapy in one day. You need to come back here to do it, say like 3 to 6 times, and the results are progressive. Okay. So, and because most of you are doctors, so you will begin to ask me, is there any clinical trial results? And there are different clinical trial results related to the heterochronic parabiotic type of therapy. And the most famous one is what I talked to you about, is the ambrosia, is a result called AMBAR, AMBAR study on Alzheimer's disease. And the result shows that 70% decrease in the rate of worsening of mild to moderate disease of Alzheimer patients. Okay, and there are also some results showing that similar results like ours, that for those people who getting this type of therapy can have improvement in the renal function by 10 to 15%. And these are the immunological data. You can see that this type of data are famous because this type of data are famous because of the COVID-19. So a lot of people become interested in using heterochronic parabiotic data type of treatment for treating the COVID-19 long COVID-19 syndromes. And this is I think the most important study is this one, which I talked to you about already, because this is the anthropological type of data, and that tells you if you can get pregnant at an old age, then you are going to get very good improvement in the rate of living to an old age. And the clinical effect of this type of therapy are as follows: that people get various results. So they get a better virility, and they don't get cold much easier. And if they get COVID-19, some of them recover very quick. And their improvement in the cognitive function and kidney function and things like that. Okay, and there are many other possible applications of this type of technique, and you can use it eventually for the stroke and for the heart disease and for diabetes and things like that. And there are also people begin to using this type of therapy into different clinical trials. Okay, so we are coming to the last part of the talk. And for most of doctors, you are going to ask me is how do I use this type of program in our practice? So the positioning of this type of program, I think there are two ways you can look at this type of program. The first way of looking at this or using this type of therapy is you can use it as an independent therapy for resident stem cell activation. In other words, because of the condition of the patient's plasma become better, so the resident stem cell in their vital organ, like in the heart or in the lung or in the kidney, will become more active. So in other words, that because of their resident stem cell were activated, so the function of the organ will begin to improve. This is one type. But for another type of application is that for those people who are doing the cell transplant or stem cell therapy or doing immunocell therapy, things like that, because our data shows that the survival rate of these cells cultivated in the laboratory is so low in the old plasma. So I think it would be very wise for those doctors to give their patient or this type of plasma conditioning therapy, okay, to improve the survival rate of the transplanted cells into their body. So in other words, you will get much better results with the same amount of, or even less amount of the number of cells. So with this technique, you can find, with our diagnostic technique, you can find the time, what's the best time for infuse the cells into the body for the cell therapy doctors. So what we are doing now is we're trying to using the technology and expand it into different type of cell lines, and we are begin to adding more and more chemical substance into the formulation, and hoping to get better results. And in terms of expansion, we are setting up different laboratories in the different cities in Southeast Asia and China. And we are also welcoming people who want to set up a joint venture clinic with us. So this is the roadmap. And you can see Kuala Lumpur right here, Singapore, Jakarta, Ho Chi Minh City, Phnom Penh, and Bangkok. And these are the cities in China. And this is what our company hoping to expand it into after the COVID-19. And because I think most of you are aware that this is not a very simple type of treatment, because each time for the treatment, each time you need to take out the blood of the patient and send it to our laboratory. And our lab will do some experimental studies on the patients, and we'll have a report and send back to you in about a week. And you can try to tune or fine-tune the plasma of the patient by yourself. But I think it's quite complicated because you need to do a lot of chemical-like of calculations. Or you can ask our representative agents to give you our formulations. So we are developing some automated machine which can compound the fluid for the plasma conditioning. So what we think in the future, what the clinical model will be like this. That is, the clinician will take out some blood from the patient and give it to our diagnostic robot. Then the robot will then send the formula to a compounding robot, and the compounding robot will compound the fluid and give it. You can give it back to the patients, and this is the model. Okay. So the take-home message is as follows: 1, stem cell dysfunction causes aging. 2, the old plasma is key to stem cell dysfunction, and this is proven by the Irina Comboy in 2016. And what we are trying to show is old plasma can be improved by intermittent plasma conditioning. So we can use a simple IV catheter to improve the survival rate of the stem cells in the patient's plasma by like 40, 50 times, with a simple IV catheter. And the improvement can last it for about, say, like up to 6 months. And for all of you who are interested, and I think maybe you want to know more about this, then it's an English book already been published about this heterochronic parabiosis. We call it anti-aging plasma exchange. And this is published this year in February. Okay. And there are one more things I want to tell you, and this is to honor Steve Jobs, the late Steve Jobs. So I think there's a twitch right here, and I think this is probably the most exciting talk about this, and I hope all of you can bear with us on this. Because the transplant surgery is getting very mature, but there is always a shortage of the organ donation. So there's a technique we call it ex vivo organ repair, things like that. So the idea is that you take out the organ of an injured human lung, which is not suitable for being transplanted. Now you use the same concept as atherosclerosis transbiosis. You connect it to a healthy swine and things like that. So with this type of experiment, you can increase the number of organs that can be transplanted, okay, in the transplant surgery. So this is the result. You can see this published by a team from Colombia. So you can see this already damaged lung, and after 36 hours of cross circulation with the swine, you can see a very significant improvement on this. So with this concept and our clinical experience, about 2 years ago, and our chairman began to ask us to look into to implement our treatment, our plasma conditioning treatment for a specific organ. And what we got interested is improve the function of a kidney. Okay. So we need to do a couple of things. One, we need to set up an animal model. Okay, and this animal model allows us to do intermittent plasma exchange. Okay, very in the lab, very simple. Okay, and the other things that we need to come up with new and stronger formulation, because we think you want to reverse a damaged organ, then you need something stronger. Okay, and with that being developed, we begin to do some of the plasma exchange experiment in the laboratory. Okay, and here are the latest result. So we are using the ischemia renal models on a rat. Okay, and this is the kidney of a rat being clamped for 1 hour or longer, and this is the result. This is the normal kidney. This is the ischemic kidney 6 days later. After is a ischemic kidney for 60 minutes, and 7 days later, this is the appearance of the damaged kidney. And this is the kidney which has 4 treatment, and this is the kidney has 10 treatments using our plasma conditioning technology. And you can see the treated kidney is almost normal. Okay, and these are the histological data. This is the histology of the damaged kidney. You can see the atrophy of the glomeruli, and without the with our treatment, you can see the glomeruli become normal. Okay, so with that, I'll come to the conclusion of our offline talk, and thank you for your time and the interest in our technology. I will take some questions if you want.
Thank you, Dr. Pan. The Q&A session is open for everyone. Anyone who would like to raise a question, please unmute your own mic, and please be patient and take turns to raise the questions. Thank you.
Good afternoon, Dr. Pan. Can I ask a question?
Yes.
I'm Dr. Aminuddin from Kuala Lumpur. Thank you very much for your presentation. I've read your book, very interesting.
Oh.
And and I'm just wondering, in terms of your priming of the patient, do you look into other parameters as to the toxicity, the hormonal status? Is there a standard preparation before that?
Yeah, basically in our lab we need to test a lot of things, because but we don't do what we do is that we need the plasma of the patients come to us, then we do some standard serological tests as well. Okay, and then but the most important one is that we need to take the plasma and go to the lab and to give it to our cell lines and to culture them. And we also give some different medical pharmacological compositions, and to try to increase the survival rate of the stem cell. This is the core technology of our method.
I heard that you have got your company in Penang, but logistically, is it possible to do it here with the time frame and frequent sending of blood plasma to your lab?
Okay. The question is this. Okay, what we are because our lab was based in Taipei right now. Okay, and the reason I'm giving this talk is because our representation is Mr. Lu in Malaysia, and we are actually training some technicians from Malaysia in Taipei right now. So we are hoping to set up a lab in KL at the end of this year.
Right.
Okay, but not Penang yet. Yeah.
Okay. So we'll be looking forward to future development in KL. But are you looking for multi-center study trial to recruit some patients from Malaysia?
Yeah. We can do that. Yeah, I always welcome all type of collaborations, including clinical trial. Yeah.
Okay.
Yeah. So if you want to do, if you know, I don't know about the regulations and since of the IRB since in Malaysia, but if you are able to have some type of resource regarding those, please let us know.
Yeah, we are very strict, but we can recruit a few interested researchers and liaise with the university or whatever.
Very good.
Why not?
Yeah.
We can explore. Thank you for your talk. Thank you very much.
You're welcome.
Thank you, Dr. Amin.
Doctor, I'm Vidya from Jakarta. Yeah, I just want to ask you, you mentioned about the preconditioning for stem cell to survive for the that you treat the patient for the intermittent plasma conditioning. What did you do for the preconditioning for that treatment?
Basically, that's what I show you. We have a special technical platform. We will take patient's plasma and mix it with different type of medications, and with the mixture, we'll come up with the best formula for stem cell survival, and that's the formula. And then you can use that formula and translate into a pharmacological dosage.
Oh, I see. I thought you prepare the patient before you do the intermittent plasma conditioning.
No. We do the intermittent plasma conditioning before patient get the cell therapy.
Oh, okay. And another question, doctor. Do you ever try to which one the treatment for the now there are so many famous for the umbilical cord for the stem cell. Did you compare that with the result with your technique with the stem cell for the umbilical? Which one is more?
No, I used to talk about the cell therapy. We do cell therapy for almost 20 years. And I think for the stem cell transfusion before this technique, I would say at the best, the return rate of the patients is very low, probably 3%, 5%. But with our technique, the retention rate of the patient is probably 60%. So patient feel the difference about this. And after the plasma conditioning, when we infuse the stem cell, then we only need probably 1/10 or 1/20 of the original dosage. And the patient already can feel the effect.
Oh, I see. Okay. Thank you, doctor.
Yeah, you're welcome.
Any next question? Any doctors? Okay, Dr. Pen, I would like to revert a question from Dr. Ng. Who can be young donor? Any inclusion criteria or exclusion criteria?
As a young donor, we don't need a young donor now, because we can do it. I mean, if you have a young donor, say like a 15 years old, younger than 15 years old, probably is the right age. But what we are trying to do is do it without the donor. We're trying to come up with a pharmacological type of solution to replace the actual donor.
Okay, I hope that answered the question of Dr. Ng. And Dr. Sim would like to ask, is there anyone with retina detachment tried the treatment?
Oh, I don't have anybody have retinal detachment. Yeah. But I do have some people who has presbyopia since that. They have good results on that. Yeah.
Okay, thank you. Doctor, and Dr. P is asking, what's the common side effect post-procedure? Any allergic reaction?
Yeah, the allergic reaction with our new formulation is probably less than 1% now.
Thank you, Dr. Pen. For those doctors still online, do you like to ask any question, please?
Hi, Dr. Pen. It's Alice here.
Hey, Alice. How are you? That's cool.
I'm good. Now, just to reply the answer for Dr. Sim, who asked about retinal detachment. Now, retinal detachment is a mechanical problem. That means the layers of the retina is detached. So I don't think any medication as such will actually improve, because you need to surgically reattach the retina for regaining the function. So I mean, just to also further on that is, any of this plasma exchange, will probably, improve any physiological aging changes such as presbyopia or perhaps glaucoma, any age-related problems. But for retinal detachment, I don't think that would help. No,
But-
just a feedback.
But Alice, I think
Yeah.
you've been giving some, you just inspire me on this. Because if you do retinal detachment, it's a surgical procedure, right? So our plasma conditioning can accelerate the recovery. So this,
Yeah,
I'm pretty sure about that, yeah.
Yeah, probably accelerate the recovery, but the treatment itself may not be able to help the retina
Yes,
to
yes.
attach by itself.
Yeah,
Yeah.
I agree.
Can I
Thank
just
you.
ask, since you got our eye expert here, is there any work on retinitis pigmentosa? I've got two patients, exploring many things to improve retinitis pigmentosa.
Alice, do you know that?
Any idea?
I think retinitis pigmentosa is a genetic problem. Unless we are able to alter the genetics, but I don't think at this point in time with plasma, I don't think we have done anything to alter the genetics as yet, unfortunately. Now, there have been a lot of experiments doing implantation of rods and cones into the retina, and I think the research is still ongoing for those kind of genetic problem where the problem is in the cell. It's a cellular problem. It's I think right now it's by implanting some of the rods and cones to replace the defect rods and cones. Probably that's the only way that I can think of at this point.
Yeah, thank you. 5 years ago, there was some work with the stem cell injected into the retina. It's work done in the Philippines. Since then, it's gone quiet. I didn't know the result. Anyway, thank you very much.
Yeah, Dr. Pen, Johannes from Jakarta is asking, what diseases can plasma exchange therapy help in? I mean, she is asking what therapy, what treatment, what disease can the plasma exchange treating?
That's a good question, because I think all the disease related to degeneration or agings are candidates for this type of therapy. And what we see the most is like sarcopenia, frailty, chronic renal disease. Some of the people who has a COPD, lung problems, and things like that. Yeah.
And what about in terms of preventive medicine or anti-aging medicine, Dr. Pen?
Yeah, that's a given, because this one is give patient an overall improvement in their virility and things like that, and they feel, in a sense, they feel cleaner, okay, and they feel more active, energetic, and things like that. Yeah, the retention rate is very high because the response rate is quite good. Yeah.
And are there any minimum dose?
I would say you would need probably 300 cc probably is the minimum dose. Yeah, because 300 cc is about 10% of the plasma volume. Yeah.
All right. Thank you, Dr. Pen. I hope that answered the question for Debbie. And Johanna is asking again, what stage of disease can be treated?
Like I think the easiest way you can address this type of question is like a chronic kidney disease. 3A, 3B, and 4, early 4 can be controlled very well. Yeah.
Thank you, Dr. Pen. Anyone else have a question to ask Dr. Pen right now? I mean, this is a very good opportunity. Everyone is here, and we have some experts from different fields as well. I think that's it, Dr. Pen.
Okay. Thank you.
All right. Thank you, everyone. Thank you for attending and spending all your precious time with us in this beautiful Friday afternoon. We are going to close the session right now. Thank you for joining us. Thank you, Alice from London, and a lot of others from Jakarta, Indonesia. I hope you have a pleasant and a good weekend. Thank you, everyone. Bye-bye.
Thank you.
Bye-bye.
Bye.
Thank you, Dr. Pen. Thank you, Mr.
Bye,
Wu.
Peter.
Bye.
Bye.
Bye,
Bye.
bye,
Bye.
bye, Suho.
See you, David.
Bye-bye.
Bye. Bye.